We're giving you 3 solutions for every one body problem today that you're dealing with. And for this next scenario, the more solutions, the better.
Did you know that more than 70,000 children under the age of 18 visit the ER every year for unintentionally ingesting pharmaceutical drugs? Is your child at risk?
70,000 kids a year this affects. And, they did a study from 2001 to 2008. There was a 22% increase in accidental poisonings. That's tens of thousands of extra kids harmed each year. And the majority of those cases, it's from prescription drugs.
And we have Dr. Cyrus Rangan on the line. He's from Poison Control. He's going to help us figure out how to not only use the Poison Control Center, but how to tell when your child may truly need to go to the ER. Thank you so much for joining us.
Thank you for having me.
So what I'm going to do is I'm going to pretend to be the parent of a child. And I just found out that my child, 2-year-old son, ingested something. I call 1-800-222-1222. That's the poison control number across the country. It's free, it's confidential, it's 24 hours a day. So I just called.
And I'll say, Poison Control, how can I help you?
So I don't know what to do. I think my son just swallowed some pills of mine.
Okay, thank you for calling. Now, how old is your son?
He's 2 years old.
Okay, at this moment, is he responsive and conscious, and is he having any breathing problems?
Right now, he looks okay.
Okay, that's very good. Are you with the child right now?
I am. He's right next to me.
Very good. Now, do you know the name or the kind of medication that he may have swallowed?
Well, my diabetes medicines are out, and it looks like he took a couple of my diabetes medicines.
Okay, so there may be a couple of pills missing from the bottle, is that right?
Yes, I don't think he took more than a few.
Okay, and how long ago do you think this may have occurred?
I was only out of the room for a few minutes, about 10 to 20 minutes ago.
Okay. Well, diabetes medications, especially in a very young child, can be extremely dangerous. And although he looks pretty good right now, he may look severely ill in the next couple of hours. So my best advice would be that your son be taken to the nearest emergency department, and we can call 911 for you right now.
Anything I should do right now? Should I try to make him vomit?
We actually advise that you don't do anything like that at this time. The best thing that you can do is to sit there and observe your child very closely until the ambulance arrives to take you to the hospital.
Thank you so very much.
You're welcome.
Good.
And that's a simulation where if we're doing that in real life, I can't emphasize this enough, and Dr. Rangan, you'll agree with me, you want to make sure you have whatever the potential pill was, and we would have gone a step further and identified the actual pill that was taken, because that does play a role. And Dr. Rangan, I was just going to say that in the case of this scenario, the child's still breathing, still conscious, go ahead and call Poison Control Center. But if your child is unresponsive, if your child is not breathing, you want to call 911, get an ambulance on the way while you're calling or just before you call Poison Control Center, because at that stage, the Poison Control Center is going to try to figure out what your child took, but they're going to get an ambulance there immediately.
That's very true. The best thing you can do in the early going for a poisoning emergency, if the patient is looking well, go ahead and give us a call first at Poison Control, and we'll tell you what to do.
Thank you so much for the service that you provide all of us.
You're welcome.
Let's get to solutions. Well, one solution is going to the emergency department. What happens? In a case like we just described, a diabetes medicine, it can have a prolonged effect in your child's body. It can seriously decrease their blood sugar level to the point where they could go into a coma. Usually, we observe that child. It may be 6, 8 hours, however long that medicine is going to be in your child's system. It could be for longer. The key is monitoring your child in a setting where if something goes wrong, we can do what we need to do. Having said that, the best thing you can do, though, is don't have your medicines in a place where your children can get to them.